Please take it, Jude. Thank you very much. Oh, what an honor. Thank you very much. What an honor. Brother Matt, I call him brother because he's more than a friend to me. A lot of people say, why do you call him a brother? But he's more than a friend to me. He has done much more than that. Thank you so much for the introduction. He has said much more than I can say. I'm not good with words, better than him. So I will just move on to talk about what I'll be talking to you today about, which is how do mathematicians model infectious disease outbreak, and how do they inform policies at different stages of the outbreak. But before I get into talking about that, let me add more about myself. Matt has presented the professional part of me, the things I care about outreach, but let me tell you how I got there, where I came from, and what got me there, what kept me working so hard, like he rightly said. But I will not say I get support from people like him. He's a great friend who's always, if I call him at any time, he'll pick my call and he'll be there to help me. I was born in a place in Cameroon called Shi, very small village. You wouldn't believe this, but going to school, I was using my flip-flops. At times, I didn't even have flip-flops to go to school. In a small village that's far from the central system. It would be difficult to relate my story to a lot of your stories, but where I was born is way far from the central system, meaning that people in the community have to determine their lives. If you are sick, community have to decide. The government will give schools, but they will not build a school. So the community have to decide on those schools. And I was raised by a single mom. I was discussing with Barbara, a friend I just met today, and about this issue of being raised in a single apartment house, 5 family members, where we never went to secondary school, but circumstances took me there. And the reason why I want you to get to know me is for you to know why I care so much about using the quantitative skills that the public, you all have, our parents, have actually helped me with, sponsored me, and got me to this level in order to inform policies within the community. So within my community, this is my village actually, where I was raised, and my house is somewhere there, and these are my farms where I used to cultivate. So we live from farm to just cultivating our crops and eating them. And if you are sick, most of the time, because in a whole location, this area here had only one doctor when I was growing up at that time. So meaning that the doctor is traveling from one area to another. So you rely on, a lot of people would rely mostly on self-medicating, and a lot of people would die because of that. So the healthcare system is not strong enough where I grew up, and partly because these communities are far away from the central system. My story will be different from someone growing up in Yaoundé, the capital of Cameroon, or somebody from the city, but because I grew up in a village where going to university will never be a thing. When we graduate, this is a primary school I'm building actually, but when we graduate, most of our houses are built with blocks, and we all do that as a community to raise that. And so growing up, I lost a lot of relatives to malaria, and I never knew I was going to go to high school. But it happened at some point that circumstances, which is a story I could say in a different day, got me from the primary school, elementary school to middle school, and then to high school, just circumstances upon circumstances with a single mom, the first in my family in a generation, actually. Then I got into school, but when I was graduating, I realized that mathematics could be used. I never knew what I was going to do with the mathematics I was studying. Circumstances got me there, but I realized that it could be used to fight malaria, and I was thinking about my village. A lot of relatives that I've lost, because at times when somebody is sick, we had to carry them to the hospital, and it would take time, and they would die on the way. And look at the healthcare system. I got it, and I was like, at that point, it was a conference actually like this. And I just stood by the door, and I heard that he was from Germany, and he came to Cameroon. I had moved from my small village to a city. So I touched that prof, and I was like, is that true? And he accepted, which saw me in Italy and Germany at that point. Through that true conversation with that one person I made there, that was a breakthrough in my life. But at that point, when I was making those decisions, what was in my mind was about that malaria, the people I've lost in my community, because if we had enough time for me to narrate the story of being able to go to secondary school, my family, it was about community. And so I usually think about community as a whole. Then when I got there, I kept on striving. No matter what I was doing was always about going back to look at that malaria issue. But proudly, I'll just fast forward that to say that today, I'm not just fighting malaria alone, and I'm not just fighting disease in my community. I'm using that mathematics to fight disease in 9 African countries and Canada itself, and informing policies in these countries. I met with the policymakers in this country that are responsible for this, and I get the data, and I inform policies not just on malaria, not just on COVID. It started with COVID, and thanks to the IDRC, but on other issues. But I want to thank the IDRC and see that the Swedish International Development Agency that led to this. So I now work in 9 African countries, and these are the team leaders that I lead across African countries. We started our government, the Canadian government supported me 1.25 million to do this, and then later on it now moved on to 7.25 million that we're doing the work that they supported. But this is about moving across the global south. But the point I wanted to point out today was about doing mathematics, not knowing what I was going to do with it, to that breakthrough moment the day I graduated, and realizing I could use mathematics to fight malaria. But I'm not only using it to fight malaria in my village, I didn't even know how I was going to do that. It's now in 9 African countries and expanding to the global south. So this is something I've done over the years. And with these countries, I want to point out that I have documented with the UNESCO earlier on last year, I documented what I did, which is based on my true story of using the quantitative skills to help this government. So there's a document you will find here on that I wrote within the UNESCO, explaining all the various stages that I did within the pandemic on helping policymakers in these countries and what was happening in local communities to control these diseases. In addition to leading this team in Africa, what we're doing, when it comes to Canada here, thanks to NSEC, I'm equally leading a team across the continent where we are trying to create frameworks using mathematics still. Again, it's very important that I point out to you that I didn't know what I was going to do my mathematics. Then I got to that point where I was able to use it to help not my village, but the whole country. And I got to that point where we're using it to help our country here in addition to what I'm doing in the global south. So I lead a group within the country, and this is a team we work together, that we're trying to create earlier warning frameworks, like you know about Blue Dot creating a framework where they were using POMATE to say, oh, we were able to predict COVID before it happened, right? We are trying to say, before a disease ever happened, can we come up with a framework that will predict it before it occurs? And so we're using different data sources and using our mathematics skills to do that. So I'm leading this team, and I must tell you that what we have come up with is very promising, and we're working towards that. This is sponsored by NSEC. Moving from that, I came in today to talk to you about how I used that mathematics to inform those policies. But before I get there, let's look at what is a mathematical model. I look at mathematical model as a representation. So you have a system. It could be you go camping with your friends, and then you come to start your car and the engine is not starting. What I will be calling here a system is the entire engine that my car is not starting. And then you kind of reduce this system from the real world to a mathematical universe where now you use mathematical formula to represent the system. In that car, you could reduce the system to just be, oh, maybe it's just my gas that's down or my battery is dead. You have reduced the system. So a simplification of that system and then using mathematical expression in order to be able to understand, to solve the problem of that system and then bring it back to the real world. That's how I look at mathematical modeling. And that's the way I define mathematical modeling. So you have a system, you have a mathematical representation of that system, and then you solve the system in the mathematical universe, as I call it, and then you project the solution into the real world. To think about that, how do you go about that? Well, there are various ways that a lot of people do that, and we have been doing throughout our lives. You identify patterns. Once you recognize patterns, then you make generalization. We all in elementary school may have passed through a point where we have a sequence or a series. Look at a series of number. we see what is happening, and we can project what number will be in a particular position. What is happening there is we are creating a model of something. We are able to recognize a pattern, and then we make generalization. And this is what we do all the time, most of the time when we're doing modeling. So you recognize a pattern that's going, and then you're able to make generalization, and then use that generalization to predict or to project what may happen later on, and inform policies in that sense. Now, when you have something like an outbreak, what are policymakers thinking about? Most of the time, if you look at monkeypox, the first thing will be, if it comes to a community like this, by the way, you guys got a great community here, very hospitable people. My friend came and picked me up from the airport. This is the first time somebody ever picked me up from the airport. Thank you, my friend. So if you have a community like this, and then a disease comes into the community, the first thing policymakers start thinking is, should we bother about this? Is it going to die down? Is it one person that's going to be infected? Can that one person spread it out? The likelihood of that one person spreading that disease out is that that one person may transmit it to one person or more than one person. If you can do that, then that will spread, because the other people that you transmit it to, they will keep on spreading. But if you cannot, then it will not spread. But once they realize that it will spread, they start thinking, can we withstand this? Is it going to get to a point where it will overwhelm our hospital system? We have all heard of the notion, flatten the curve. How do we ensure that we do not have this project above our capacity? This is a question that runs in their head. Once they realize that that disease is going to get into something, they ask that question, okay, if it's not going to get there, well, we are able to keep it below our means, so let's try to find other ways. Now, at this point, they will not turn to people like you with your skill set. How do you apply what you have learned to help us determine whether this is going to get to that level? You hear me today talk about two things: basic reproduction number and herd immunity. So two key things that I will be talking about here, which is what happened at the onset, which you hear me talk about basic reproduction number, and what happens when the pandemic is already going. You hear me talk about the herd immunity. We'll look at this concept, but just to point them. Once they realize this, they will not turn to a mathematician like you, a computer scientist, and said, look at the number, how the pattern. That mathematician will now start looking at this and said, okay, let me get the data and see if I can recognize a pattern. If I ask all of you here right now to tell me what pattern this is, you will say, oh, this is almost growing exponentially, which is true. And you can't be able now to generalize this because you see the pattern, you recognize the pattern. And from what you have learned a lot, you know how to model this. There are various ways to look at this pattern and then generalize that, since you have seen that's growing exponentially. So that's why they would tend to a mathematician to be able to do this. So, and this now leads me to a point where I will now bring the bigger questions that I wanted to talk to you about today. So we have a clearer picture of what really transpired there. You now know who I am. We know what runs in the minds of policymakers when we have an outbreak. What happens when they get to a mathematician? Because you need data, you start collecting the data. Let's now get to what the questions are. The bigger questions I wanted to talk to you about today will be, how do we build that model once we start collecting that data? From a simple model, where do we start from? And once we ascertain that, if we succeed to build a model, and I always want to borrow from box, no model is perfect, but some models are useful. Once we build a model that's useful to us, how do we use that useful model to inform policy? And this I think. Now, in building a model, today we'll say, how can we construct a very simple model that you don't need to have been in school? If you go to my community where people are not privileged to go to school, can you be able to give them the notion so that they can create their own model and inform policies? How do they get to that point? How do we use this notion of this basic reproduction number and herd immunity? I want to just shout about this basic reproduction number because it's a very, very concept that we all should know. If I were to come into this community like this with a disease, God forbid, I didn't bring any disease here. So, but if I were to come here with a disease, and then I stay here, and I get in contact with people and I start infecting people with that disease, if you find out from the time that I was infected till the time that I recover, the number of people that I infect, if you average that across the population, that's what we mean by basic reproduction number, because this population was naive. And so you're looking at, if you have a naive population that's not open to a particular disease, and then you introduce someone with that disease in that community, how many people would that person infect within the time course of infection? So that's the concept here. We will get into that now. This herd immunity will be potential to resist because we have maintained a certain level of immunity within the population. And what is that immunity? And this basic population number will help us. And we use this a lot once disease is already going at later stages of the pandemic, or an outbreak. But we'll look into that. Now, once we build a simple model and we know these concepts that are helping with policies, how do we extend that when we get more information? One thing, no model is perfect. Some models are useful. You constantly need to refine the useful model because you get more information with time. Each time you need to refine that. And so we'll look at how do we extend it at different stages. And that's not the unique way to extend it, just so that we know we always extend it. And then the second part will be how then can we use those that are useful to inform those policies. So I'll start with the first question. Let's assume that day 0, Jude comes into this community. And Jude is sick and get in contact with his friend, Matt, other people, and then infect them. And then before he recovers, or he infects within these 3 people. And then they go on to infect other 3, each of these infect other 3 people. Let's assume that this is Matt, this is Barbara, and then some other person. And then, Matt, I'm not infecting you though, I'm just, and then they go on to infect. Now, if you look at these, you can't be able to determine, based on this pattern that you're recognizing here, you may be able to make a generalization. And if we look at this, on day 0 was 1 person, day 1, 3, day 9, day 2, 9. Here, how many people will be there? Okay, and so on. Thank you so much. And so if you look at that, you realize that it's 3 days to the day that you're considering, right? So we can generalize this. And believe me, this is already a model. This is a model. If you get that data and you recognize that pattern, because then you can build a model that generalizing that. Now, once you build this model, you can then try to say, okay, if I match that model with the true data, I'll get almost something similar. This is building with COVID. Can I then use the model to see what will happen in 1 week so as to help government to prepare? Can I use the model to see what will happen in 2 weeks? If you project that model forward, because it's exponential, you keep on going. And so you can use that model. Now, what you see in this model is that this model is not taking into account the dynamics of the population, the behavior of people. It's just assuming that following the infected cases and assuming that, okay, I have these are the cases. It's not taking into account the dynamics of the population. But we are very smart, right, guys? At some point, what will happen? We will realize that there's something dangerous. I need to run away from these guys. And what will happen? Even though the model will keep on going, the virus may not find people to infect, right? But that model will keep on going. And this is what happened then, that you need to go back now and start asking more questions. So if you feed this model into data, if this was an outbreak, you realize that this will continue going forever. But infectious diseases that have a particular characteristics, they always go up, plateau at some point, and then come down, because we are very smart, and we learn things. But that model will just keep on going on forever. What then do you do? Again, there are various ways you could look into that. In the phenomenological model, it's data-driven. In the mechanistic model, you're taking into account the mechanism involved in the dynamics. If the virus starts running out of people to infect, you take into account that. If people start changing their behavior, you take into account that. And so most of the time, most mathematicians move to the compartmental model, which is what I'll talk about here, to build a simple compartmental model that takes into account people's behavior. Because this will fail at some point, but at the starting point here, it worked perfectly well. Because it was capturing that people were not changing their behavior, but later on it fell. But take note of the fact that even if you were informing policies, you will be able to inform policies within the almost the first 3 months. And that will help save a lot of lives. So even just with the basic progression, arithmetic progression that you have learned, you're able to use that to inform policies within that time. Now, when that fell, we may now want to move mechanistically to say, what mechanisms exist? Can I take into account the actual dynamics here? And most of the time they use this compartmental model where you assume that you divide the population into 3 compartments. You have the susceptible population, the ones that are already infected, and the ones that have recovered. You assume that, oh, people must get infected. Somebody comes in, this is not me though, I don't believe so. Somebody comes in who is infected, and if that person get in contact with somebody, there's a chance that person could be infected or not. And at some point, if the person becomes infected, then he joins this infectious class. And when they recover, they join that, they are removed. So you're not only keeping track of the infected cases, but now you're tracking everyone, those who are already infectious, those who have recovered, and those who are still susceptible. That's the compartmental model. You are breaking the population into 3 different compartments. Now, when you divide the population, you assume that, well, if you come in contact and get in contact with somebody, that person must not necessarily be infected. There is a probability that if you get in contact with that person, with a certain probability that person will be infected. There's a transmission rate here. So if you get in contact with that person, you can either become infected or not. You end up that person coming here, or that person joining you on this part. So if you now look at this, if we have that this number of infectious people come in contact with this population in a community, then within this chance, a particular group of people will leave this class into this particular class. And then after a time period, 1 over this mu, which is the recovery rate, they will recover from the disease. After a particular time, they will recover, which will be proportional to the number of infectious cases. Once you build this, then in reality, what you are saying here is, you have, well, the rate at which people are changing, this class is reducing, will just be proportional to the number of susceptible and the rate at which susceptible are getting in contact with the infectious cases. So this would reduce. Minus here is indicating that they are reducing, leaving that class to join another class here, which will now be the infected class. Once they leave this particular class, because this susceptible need to get in contact with the infectious, and within a certain probability, once they get in contact, they may leave and join this class here. Once that happens, then they are no longer in this class. They are now infectious, and they can now move on to infect other people. And then after a particular time, it could be 10 days, it could be 14 days. They'll cover it with monkeypox 21 days. It could be a particular time. Then they will recover and then become the recovered. Again, beta here is the rate of infection, and mu here is the recovery rate. 1 over mu will be the number of days that it takes for them to recover. And then if you feed this into the model, you realize that it will capture the data very well, because you are taking into account the actual dynamics. And this model, as simple as it is, can go a long way to inform a lot of policies. For instance, the first thing that this model would do when there's an outbreak would be, once I have that reliable model, can I determine that value? Why is that value R0, basic reproduction number, very important? It's an epidemiological concept that's very important because you can use that to see whether the disease will, you have an outbreak or will just die down. And if there's an outbreak, is it in a way that will overwhelm the hospital system? Should we be worried? And in order to calculate that basic reproduction number, which we already have here, well, it's just basically the probability that when you get in contact with somebody become infectious times the total population, which is, assuming the population was naive, that's why you have the total population. If there was already a certain level of immunity, it will not be the total population. You're assuming here the population is naive. And then the time period it takes for them to recover. Now, you must not do this mathematically. You can just follow one person and say, by the time this person is in our community, how long does it take? How many people would this person infect within a time? If you're doing kind of a simulation, you can just put in an infectious person, run your simulation and find out how many person that person will infect, and average it across the number of people you consider. That will give you the basic reproduction number. The basic reproduction number, when we assuming that there are no control measures, the population is naive. If the population is not, then we lead to what we call control reproduction number. Now, at this point, if this value is very high, then you realize that you may end up overwhelming the hospital system. If this value is very low, there's no chance. But if this value is less than 1, below 1, there will not be an outbreak. So you don't have anything to worry about as a policymaker. We'll get to that. Now, how do you look at this value? Well, if at the onset you realize that this value is very high, there are 2 ways to control this value. One way is through this beta. Another way is through this other value here, how long it takes for them, how long they are infectious. Most of the time, policymakers will focus on this, and we'll talk about this, how long they are infectious. You contact trace them and remove them from the population. Then they no longer become infectious. You reduce that time. Once you do that, then you reduce this value, and so this value will not be very high, and you don't overwhelm the hospital system. Another possibility is reducing this, which most of the time is through vaccination, lockdown measures. Once you do that, then you reduce that, and then you end up reducing this value, and so you don't overwhelm the hospital system. So you look at this value, and again, we'll look into that. The other concept is that of the herd immunity, which is the resistance to the spread of the disease, like I earlier on said, that occur when you already have a certain level of population being immune to the disease. Most of the time, in order to calculate this quantity, you can use the basic reproduction number to calculate this quantity, which would just be 1 minus 1 over the basic reproduction number. What this means is that, well, if the basic reproduction number is very high, then you have a lower population that's already immune, and the herd immunity is very low, and so you may end up having a high outbreak in the country. So they are related. And if this is very low, then you have a very high this, and so you will not end up having, you have a high population, that's percentage of the population that's immune to the disease. Now, what are the various extensions that may exist with this model? Assuming that you have already designed that, the basic reproduction and the model is working well, you are informing policies. I live in Toronto, a place called York Region, which is another part of Toronto. And this was an article, something that was published earlier on when COVID started. And there was a story about if you are living in a household and somebody is infected with COVID, that person will be quarantined for 10 days. But you living with that person, you're quarantined for 20 days. Again, if you don't think deeply, you'll be like, why would somebody who has this quarantine only for 10 days and I have to stay in for 20 days? Right? You ask that question. But when you look into that, you'll be like, okay, there's another thing that if you were using the other model, this will not make sense to you. But this is the time now for you as a modeler to say, there's something that has been discovered. Maybe we need to refine this model, maybe through the data. Which means that what is happening here is that there is what we call the host class, the incubation period, where it takes a time. Once you get a virus, it takes a particular time period for you to become infectious. But if you look at the previous model, we had not taken that into account. And so if, as a modeler, if this information becomes new to you, then you need now to introduce that. Instead of having now just 3 compartments, oh, this is recovered, you now introduce another compartment because it takes a particular time period. People leave this class, come into a class where they are not directly infectious, but it's after a time period that they become infectious. And that's why that's taken into account. So you continually refine that model. Even earlier on, when this information became available, there was another information on CTV. There was earlier on where we became aware of the fact that there were a group of people that could transmit COVID-19 but without showing any symptoms. And assuming that you had moved on to the point where you had a simple model And remember, we started from a data-driven model to a point where we use a simple compartmental model to a point now where we now said, okay, at this point, I have a model that's working. But then we realized that there are some people that will be infected, but actually they will not be able, it would take a while for them to be infectious. And we now introduce the exposed compartment. Now, after that, if it's working and then this information come in, we need to introduce another class of people that when they live here, they will not become infectious, but they will become asymptomatic. You see, it's the same model, but once the information become available, I just add another compartment to capture that dynamics and break that down because it's distributing people. Well, now what I'm saying is that a fraction of the people living here will go here, and a fraction will come down here. If you take this to be fraction to be a whole fraction to be 1, then 1 minus, if this is already going here, then 1 minus this is coming here. And they will recover, they may recover at different time or at the same time. But again, you realize that what is happening is that as I get more information, I'm just adding compartments to capture that more information that I'm getting. Another thing that could happen is, if you look at this is the map, the traffic map between different continents. This is Canada somewhere here. There's a lot of traffic between Europe and Canada, right? Maybe Australia is somewhere here, but if you look at Africa, not that much. So if you look at Africa, not much traffic. Now, if there's an outbreak in Africa, and you're a modeler, the chances that will come here will still be high, but not that much compared to if something was happening in Europe, right? Or in Australia. So if an outbreak occur here, another way to modify this would be, oh, it's spreading here differently. How do I determine the number of cases that will move from here to here? If this is happening here, how can I study how that will influence the cases in this community? Or let's look at even traffic between Toronto and this and Moncton, the flights that are coming to Moncton from Toronto. How would that influence if there's an outbreak of monkeypox in Toronto? How does that influence here? Now, you could now come up with a simple model where you consider Toronto, Moncton here, still keep the same simple model that we had earlier on, but then you take into account the traffic. These values could be different. Where people move from one community to another. Remember, you're not having the same model, but not taking different regions into account. So you see that we're using the same simple model, the same concept will still be there, and the same concept will still be using influence policies, calculated differently now because different parameters are taken into account here. But it's still the same model, either introducing compartment or dividing into regions as needed. Now, how can all this model, there are different ways you can modify this, but how do we then use it to inform policies? I started by discussing how that concept of the basic reproduction number and herd immunity are used. And I would really want you to leave this place with that notion of how, from a basic perspective, using data, you can get a model and be able to determine this basic reproduction number and what it means, and herd immunity. Because you hear this a lot. And these are some of the things that are being used to inform policy at the onset. Let's look at what's being used. Okay, I have an outbreak that entered Canada. Well, I know that if I collect my data as what we have seen, I can project a simple model, and then I can calculate this basic reproduction number. From there, I will then be able to say, well, if this basic reproduction number is very high, I may end up overwhelming the hospital system. Very low, I may end up in this situation, or things may die down. As a policymaker then, what do I do? Should I immediately call for a lockdown? No, policymakers don't call for a lockdown unless it becomes very necessary. The first thing would be, can I control this value here? Can I control how long the people are already infected? And that's why you have things like contact tracing. You contact trace the people and reduce the time that they're exposed to other people. For instance, I'm sitting here and then you just see somebody come, hey, you have to come now with us because we learned that you just came from Toronto with this. Not me, though, somebody that looks like me. So you contact trace them, remove them from the population so that you reduce that time that they're exposed to the entire population. once you do that and you realize that this value is still very high, because you're doing that to reduce this value. Since we have realized, we all have agreed that this value is very high, then we end up with more cases. Once we do that and realize that this value is still very high, the next thing we want to do now is to target this guy here. Assuming there's no immunity in this community, it's a naive disease. In order to target that, maybe we develop a vaccine to reduce that. Or maybe we put down lockdown measures, which is what happened within COVID, to reduce that value. Once we do that, we reduce that, and then we reduce R0, and then the disease will stop spreading. It will come down to this value here. Again, we all know that always the disease outbreak have a particular characteristics. They will always go up and then come down. But the fear is always to overwhelm our hospital system, and people dying, which is really dangerous. Overwhelming the hospital system is what policymakers at times focus mostly on. And so reducing this, like I already said, will be basically focusing on these two. And once you do that, you then reduce that. Let's look now at the other concept of flattening the curve, which is exactly what we have discussed on. If we are able to reduce R0, then we end up in a situation where this doesn't go above this hospital capacity. We are at this situation, which is what we would love if this is above our control. But what if we do that and it doesn't work? Then we move to beta here. And this will be done, like I said, through physical distancing, lockdown measures, vaccination. If we do that and that doesn't help, well, then we keep on more lockdown. That will end up with a situation where we may end up reducing that. I will now point out to some of the work that we have done which contain herd immunity. With the herd immunity, in order to do that, this is when the outbreak is already going. Let's assume that we now have vaccines, everything's going well. How do we realize that we cannot let life go into normal, where we realize that R0 value is less than 1? If we have vaccinated a particular population, or depending on what R0 value, which could be a controlled reproduction number at that point, depending on the people that are immune in the system, or if we realize that R0 is already very low, then we have a high percentage of the people that are already immune to the disease, and then we'll end up in a situation where they will be resistant to the spread of the disease. An example here would be, I was just pointing out a situation here where if we have, for instance, an R0 value of 15, like in measles, then we end up in a situation where the spreading rate will be very high, and we will need to vaccinate, or to reduce a higher proportion of the population. We need to reduce 93% of the population in order to reach herd immunity, because of the R0 value being very high. But if this R0 value is very low, almost close to 1, then we don't need to vaccinate a lot of people in order to get to that value. So this value of R0 is very important, and calculating and knowing what it is at the onset of the pandemic become very imperative. Moving from there, I'm just going to share a work here that I did with my friend, which is in line with informing those policies. This is, was led by my friend Matt here. Very, very great paper that we wrote earlier on at the onset of the pandemic, and it was working really well, though we had to refine it later on, but it was working really well to inform policies, where we calculate this, and this was the data part of it. We recognize pattern, we use a simple model, taking into account the behavior at that point, projected what was going to happen and different scenarios. What could happen if this changes? And this is how you use that to inform policy. You project ahead of time. At this point, we were at this point. We projected into telling policymakers what was going to happen in Ontario at different time points. And this is a value of that R0 where we said, oh, if these policies are put in place, this is where we'll be. If these policies are put in place, at this point, this is where we'll be. I must say that if policies are put in place, lockdown, and then we remove them, then we'll have another outbreak. The model that we came up together, which could be found here, worked really pretty well for a time period till a certain point where people change their behavior. And that called for you refining the model back. So in order to make it go, the first thing you always have to do is, the message I've passed here is that all infectious diseases have the same characteristics. They always go up if there's a spread, and then they come down. The other thing that we have discussed here is that model can be used to determine the risks of a disease becoming an outbreak. if there's any. We have equally talked about models being used to forecast. And this is any model that we develop, be it the data-driven model, can be used to forecast to know what will happen next few weeks. The model can be used to help you determine how to flatten the curve, where you're able to advise policymakers what they need to do in particular, and the extent they need to do that in order to flatten that curve. And again, I presented a work where we look at different intervention measures. So a model can be used to do that. Once you take into account, you see the parameter and say, if I change this, what happened next? If I change this, what will happen? And then, in my case, I do this every day, especially when there was COVID, and we meet with the policymakers who said, this policy will lead to this. This policy will lead to this. This policy. I am not the one to determine that. As a modeler, I am there to tell them the truth. Politicians take the truth the way they want to take it. They can go to the public and say what they think, but I will give them the truth as it is, without thinking whether or not this will get them the vote or not. So you just tell them what will happen if they put a particular policy. Now, the most important thing I want to say here is that once there's a disease outbreak, data becomes very important, which is the most difficult thing to come across. Data is very difficult. Realistic data is very, very difficult. If we're able to get data, then you formulate a model, and you keep on refining. As you saw me refine the model, till you ensure that you're capturing the parameter at different time points. Some model will be useful within a time point, and then they fail to be useful, you have to refine them and get back again. And then once the model is, you find it useful, capturing it, then you can use focus and inform intervention measures. This is what we do, this is what I continue to do with the government I work with, and this is what mathematicians do, and this is what you will do when you go out there with what you have learned so far, or with the knowledge you have. I know a lot of the time we don't realize the knowledge we have, but I think at this point, doing mathematics or computer science in the University of Statistics, you have enough knowledge to inform policies. It's just about being put in a situation where you have to use that knowledge, because you already got that. I want to thank my students. These are my students and postdocs at the University. The work I do, they're just behind it. They work so hard. It's not just me. You may say, I have this number of publications, but this is the team that have really done that work. So I give them credit for the work that they have done. And I want to thank my sponsors, NSEC, IDRC, the Swedish CIDA, and the New Frontiers in Research, RDC and other funders that have funded here, and the Canadian Black Scientists Network. And thank you all for support.